Our conversation tonight focuses on matters health. Mary Muthoni is the Principal Secretary, Public Health and Professional Standards, and she joins us in studio tonight. Karibu sana PS, how are you doing?
Thank you.
How's the
Thank you
ministry?
so much. The ministry is okay. We are charged.
Yeah.
We are good to go on the reforms, the many reforms that we have introduced. And we are ready to offer Kenyans an available, acceptable, accessible and affordable quality healthcare.
Fantastic. We'll talk about accessible and affordable healthcare in a bit. But just as you were making your way to studio, I think you saw the complaints there by clinical officers as well as, I don't know, nurses about promotions, and they were complaining about some cadres being left out. I don't know, what is your response to them?
I saw that, but really, even if you look at the advert, I don't think it locks anybody out. As long as you have the qualifications, if you're a clinical officer or any other cadre, and you have a degree, you have a master's, you're free to apply. But I hear them, and these are my good friends, and I would want to invite them, even if it's tomorrow morning at 7 a.m. in my office, so that we are able to listen to each other. The government has a listening ear, and they know that when I sit in my office, I offer them an ear. I would want we meet tomorrow and we hear what are the complaints. There could be a little more, which I do not know. And because I've just seen it, I welcome them so that we can clear up the air.
It's an open invitation to the gentlemen that were there to see the PS tomorrow at 7 a.m. Probably you'll get your issues resolved in that meeting. When you talk about universal and affordable healthcare, let's talk about the components of what makes healthcare affordable and accessible, so that we move now to the reforms that your ministry is instituting.
Now, the implementation of universal healthcare is one that is anchored in the bottom-up transformation agenda. And when you talk about universal healthcare, it is healthcare that is affordable for all, equal to all, equitable to all. Therefore, the Social Health Authority is the primary vehicle. And remember, in December, we have the four acts that were, the four bills that were signed into law. And Social Health Authority is just one of them. Again, Kenya is working on strengthening the primary health care, which we also have the Primary Health Care Act of 2023. And then again, the flagging of over 100,000 community health promoters. In fact, after the summit that usually happened between the national government and the county government, we got an approval to add another 7,800 community health promoters that are going to be the anchor in the primary health care at the bottom of the pyramid. Again, the government has provided about 110 smartphones to the community health promoters. That will help in terms of registration on the ground and to get issues. And this is connected up to, digitally connected to the national level. And we are able to see from a dashboard how many people have been seen in a certain period of time by the CHPs and what are the issues. Then again, the investment in public health facilities, the infrastructure, the establishment of the 315 primary care networks, it forms the bottom and the base of universal health coverage. Then again, when we talk about the PCNs, we are in continuation of establishing the same. We already have about 105 primary care networks that have already been established on the ground, and another 50 that are already continuing, and we hope within no time we will establish more than 315, exactly 315 primary care networks. And these networks forms the base of also our referrals, because the referral system starts from the household level with the community health promoters, the 107,000 community health promoters. If a community health promoter comes to your household and finds that there are issues that are beyond what they are able to really cater for, because their work is really very basic, checking on your blood pressure, the blood sugar, reminding the mothers and caretakers on taking their children for immunization, reminding them on public health activities around their household, even basic things like sweeping, personal hygiene issues. Your children going to school, do they have handkerchiefs? Are they cutting their nails to their size? Environmental issues, planting of trees, and especially the support of the 15 billion trees. His Excellency, the President, has been advocating for other environmental issues like clearing of the bushes to ensure there are no mosquitoes around your household. Vector-borne diseases may not get us, you know, and waterborne diseases like cholera, you know, issues of water, clean and safe water. So what the community health promoter may not be able to treat, like injecting people on issues to do with maybe tetanus, then they are referred to probably a community health nurse or to the nearest health facility. Again, at the ministry, we have already done an assessment of all the levels of health facilities in the country. There are more than 14,000, and that includes the public health facilities, the private health facilities, and the faith-based health facilities. Because the primary care networks will revolve that. Nobody at any one time will go to a health facility and you're returned because you don't conform to a religion, or maybe you cannot afford. The Social Health Insurance Act, again, as I am going to discuss in a few minutes, is gonna take care of all that. Therefore, when I started, I talked about available, accessible, and affordable quality health care. And that is what the Ministry of Health is standing in for.
Let's talk about SHI, PS, because much of what we've seen in the news really is about who is being taxed what, at what point, and what is happening. But I wanted to take us through the good news of the Social Health Insurance Fund, because much of what the public has been treated to is the other side of SHIF.
Thank you very much. I think there is no better time to live in this country than now. And one of the newest things that has been introduced in the Social Health Insurance Act is the 3 funds that are going to take care of everybody. And one of the funds is the Primary Care Fund, which is going to take care of the lowest level of the health facilities. And this will ensure that when you go to any health facility at the level of level 2, level 3, you don't pay a thing. You will not pay those 20 bobs that you used to pay. Or when you go to these health facilities, you're told go back because you do not have money. Nobody will ever be returned home because they do not have money. And this money that we will be able to plow back to these health facilities. It's part of the 2.75 that me as a PS can be deducted to also build into the building, I mean the infrastructure of the health care. Then the second fund is the Social Health Insurance Fund. And this is what you normally used to call the NHIF. First and foremost, instead of paying the 500, then you will be paying 300 shillings. That's a shift from a higher mark to a lower mark. And anybody else who has a higher salary, then you will pay your 2.75 of your earnings. Therefore, that means even in my household, those who are not able to pay 300 shillings, I can be able to cover them within my range. The other thing about the social health insurance, there are those people who are not going to be able to pay, the indigents in our society. Then the government chips in. And we have a means assessment to get to know who is a real poor person, as you may put, and who is able to cover themselves. Because there are those who, even if you give them 50 bob, they will not pay. And they'll not be able to pay. So the government is going to pay for this. The other fund that we have is the Chronic Illness Fund. And the Chronic Illness Fund comes in multiples. Remember, each one of us here is either affected directly or indirectly by somebody who has a long-term disease, maybe cancer, those people who need dialysis. And most of the time is when you go with your NHIF card, you're told your card is depleted or you don't have enough funds. By the time you finish your registration, you can't even go for even a single test. Now, that is going to be a story of the past, because if your card has gotten depleted of the funds that are there through the social health insurance, then we will plow into the chronic illness fund. Therefore, we will not have people going out there to fundraise, you know, the WhatsApp groups that we have, so many of them, so that you're able to be treated. Again, if you look at issues of screening, many people do not go out to get screened, maybe on cervical cancer issues, breast cancer issues, even for the men, you know, probably because of they do not know or general ignorance. And secondly, they may not afford to get screened. So all these benefits come with the Social Health Insurance Act that will cover each and every one of us at every given time in our household. And this again is interconnected with many other acts, the other 3 acts that we also have. If you look at the Digital Health Act, it's interrelatability of data. When we were growing up, each one of us used to have a quota exercise book in our home, which my mother could not lose, because you had to produce it to the doctor or whichever health, human resources health, when you go to any health facility. And that slated all your stories about where you're sick, what type of medicine you are given, maybe the doctor who saw you or whoever who saw you, and what action plan should be taken next. Therefore, the Digital Health Act provides for information between one health facility to another health facility. If you have been referred from maybe the village, from a level 5 hospital to level 6, then by the time you get to Kenyatta or KUTTRH, then the health, the staff who is waiting for you, or the doctor, already knows what type of disease you've been suffering from or what medicine you've been taking, and they are able to now interconnect into what needs to be done next. Then we equally have the Facility Improvement Fund. We are going to a point whereby funds that are allocated for health the fund is ring-fenced and no reallocation for other functions. So we will not have funds that are ring-fenced for health being reallocated to another function like roads, construction of roads, and many other subjects that are at the county level or even at the national government. So it would be important that whatever funds that are gotten meant for healthcare is really utilized for that, either for infrastructure development, for human resources employment, or even buying of equipment. Remember, when we talk about primary care, we want to get to a level whereby our surveillance is really high and sophisticated, in the sense that we are able to detect these ailments at a very early stage. Therefore, the right equipment is required at the right level of hospitals.
Let me ask very quickly, PS, as we near winding up, on the issue of this facility improvement, because we have had quite a problem of Kenyans really who are going to India or other places to seek treatment. Let's say, for example, for a chronic disease like cancer. Is this the silver bullet that this facility will go towards the improvement or eventual construction of, facilities that can help deal with cancer?
You know, everything when it is anchored into a structured format, it works. And we always say where there's no plan, where there's no structure, you're bound to fail. And that is why the first thing we did at the Ministry of Health is to structure by coming up with the laws that are going to guide us into what is supposed to be done. Therefore, the Facility Improvement Fund is meant to be plowed back to improve on the facilities. Sometimes if you look at mothers, you'll find that they are overexposed, maybe they're lactating mothers. Or even you'll go to some health facilities and they do not even have partition when a mother is giving birth, which is very demeaning. So improving such kind of infrastructure is very, very critical. And if you look at even the governance structure on in some of the health facilities that has already been laid down is very critical, because the chairman will come from the community, the secretary, the composition is all inclusive, including the private, faith-based, and even the public hospitals. So as the community, we will decide what we will do with the funds that are in our health, collected for our health facility or allocated to our health facility. Remember again, we also need to utilize the issue of human resources for health, improvement into do we have enough dietitians in a certain facility, depending on the levels. At the lowest level, you may not need complex professionalism like neurosurgeons and all that. But as we go higher into the levels of health facilities, level 4, 5, 6, we may need maybe somebody to operate your knee. You may need somebody to operate your head, somebody to operate your heart. So at the end of the day, we will need to improve these health facilities depending on their levels in terms of equipment, infrastructure, and human resources. And I told you that we have already done an assessment of all the levels of the hospitals in this country. We know the gaps. We know where the challenges are. That is why even our engagement with the county governments, remember, health is devolved. And our role as a national government is creation of policy and training. All right. And the rest of the demands, I think you would want to hear this.
Very quickly. Very quickly
the rest of the issues, implementation of the same is the role of the county government. But I'm happy we are working really quite well. And even in some of the programs like the community health promoters, which we have, we are working in collaboration. We have already started paying their stipend, because the agreement with the intergovernmental agreement was we pay half and they pay half. 2,500 coming from the national government, 2,500 coming from the county government. And we are already fulfilling that bit. From last week, Friday, we have been paying December and January arrears for the national government, just to ensure that these people are motivated and they are able to advocate and really promote health, public health activities at the bottom of the pyramid and in our households.
Absolutely. Thank you very much, PS. Of course, we hope we can have you again. These are engagements you need to keep having, particularly between us and your ministry, for people to understand really the kind of reforms that your ministry is implementing, particularly on NSHIF. But you've done a good job really in explaining what it means for Kenyans.
I'm not sure if we are done.
Yes, we are done.
I would have wished to kindly request all the nurses who are unemployed that the government is very keen on labor migration, and it would be important to keep checking on what is happening. Right now, we are advocating for nurses who would want to go to Saudi Arabia, 2,500 spaces that are there, and they can apply through National Employment Authority. We also have upcoming for the UK and the US. And of course, locally, you have seen we have advertised positions through PSC, which are up for grabs. And every year, I want to assure Kenyans that our KMTC produces more than 20,000 professionals every other year. Graduates are more than 20,000. Right. Therefore, we will continue producing quality for the care of to care for Kenyans.
Quality to care for Kenyans. Yes. And we wish you the very best, Madam.
Thank you.
Mary Muthoni, of course, as you continue to dispense with your mandate. Of course, probably in the later interview, we'll talk about some of the other things that you're doing in your ministry. But that is Mary Muthoni, the Principal Secretary in the State Department for Public Health and Professional Standards, and really breaking it down for us, particularly on the reforms the government has sought. The deductions begin in July. It was important that you understand what it means for you and your relatives. Thank you very much, PS, and thank you. Have yourself a good night. This is where we put a cap on Prime Edition. God bless you. Good night.